Welcome to the special live series of Only My Health, where we discuss important aspects of health and lifestyle. We have with us our experts who will be guiding us about how to maintain a good health, good diet, and a healthy lifestyle. So today we're discussing about a common element that runs in every household: high blood pressure and cholesterol levels. And to give us important aspects on this topic, we have our expert, Dr. Nitin Parashar, Assistant Professor, Department of Cardiology at All India Institute of Medical Sciences, New Delhi. Welcome to the live session, sir, and thank you for joining us.
Thank you so much, ma'am, for having me invited on your show. And I would like to say that this is a great initiative from the Dainik Jagran team. With the help of this initiative, I think people are going to be more aware about these risk factors of cardiovascular diseases. They'll be able to identify these risk factors before getting these diseases, and once they are able to identify, they'll be able to better manage them, and this is going to help them and ultimately the risk factors will be managed well, and the cardiovascular diseases that once the risk factors have developed, again they can be managed better. So the awareness is very important about these risk factors, since a lot of people, they are not aware that these risk factors can cause a lot of problems later on in the life, so they don't care much about these risk factors. So these two risk factors which you told, hypertension and high cholesterol levels, they are very, very important, and they are major risk factors for cardiovascular diseases.
Thank you, sir. So let's start with this question. Over the past few decades, there have been a significant rise in the number of people witnessing high blood pressure and cholesterol levels. Can you please tell us what is the cause behind it?
Yes, ma'am. You are right. The prevalence of these risk factors and the diseases, coronary artery disease and cardiovascular diseases, the prevalence of these things is increasing over the years. And there are many factors, many causes which have been postulated. First of all, I'd like to say that the aging population is increasing with the advancement in medical science. Now people are living longer compared to previous. So previously people used to die in 50s or 60s. Now with the advancement in medical science, we are able to treat better many conditions, and the aging population is increasing over the time. And these risk factors, hypertension, cholesterol levels, these increase over the time as the person grows. So with the age, the risk of having these risk factors increases. So that is the first cause, I'll say. And secondly, our lifestyle has changes a lot. Previously, now people have become more sedentary in their lifestyle. They will get up in the morning, will go to their offices, and in the evening they'll come back, they'll go to sleep, and in the morning this routine goes on. So most of the time they are not doing any physical activity. Anyhow they are doing, that is very minimal, just related to the work. So the level of exercise, the physical activity levels, they have decreased over the time. So this is the second thing I'll say. And thirdly, the urbanization has increased over the time. So people are living in the cities where the level of pollution is high, and pollution, we know, that affect in very various ways that can also increase the risk factor. And with this lifestyle, the level of stress has increased in people. The anxiety levels have increased, and this stress can again cause various heart diseases. That this can lead to increase in the risk factors, the hypertension level, the blood pressure level, cholesterol level. These can increase because of stress. So these are some of the conditions which have caused increase in the prevalence of hypertension, increase in the prevalence of cholesterol, increased cardiovascular diseases.
Yes, correct. We were talking about stress. So can you tell us how can stress cater to this disease? Like how can stress levels cause this disease, and how can we combat this situation?
Yes, ma'am. Stress is one of the now major risk factor, now more recognized compared to older times. Previously, nobody would think that this stress can cause hypertension, this can cause cardiac diseases. Nowadays, it is increasingly recognized that stress can also be a major factor causing these cardiac diseases, cardiovascular diseases. So one of the reason is that it increased stress level, they lead to increase in the catecholamines, adrenaline in the body. So they will increase the blood pressure. Second thing, these catecholamines and adrenaline, these neurotransmitter will cause the damage to the endothelium. There is increased activation of RAS system. There is one system in the body, mechanism in the body that gets activated more compared to the normal people. So overall, the stress in the vessels increases, that will increase to the blood pressure. And over the time, this can lead to deposition of the cholesterol or other things in the vessels, and this will lead to the increased incidence of the cardiovascular diseases. So controlling stress is one of the major job. That is one important thing we should consider, we should think about it.
True, correct. So, sir, my next question to you is, what is the major issue with high blood pressure and cholesterol levels? What are the diseases that can follow after it? And if it is not treated on time, what can the situation lead to?
Right. So this increased cholesterol level, increased blood pressure, these are the risk factors for various other diseases. So what happens when the person will develop hypertension? Immediately he may not feel any symptom. If cholesterol level is high, he may not have any problem. So if he thinks that this is normal, this happens. So the problem is that over the time, these risk factors can lead to increased risk of the cardiovascular diseases. The person will have more chance of having heart attack. So how does it happen? So suppose cholesterol level increases in the body. Over the time, there will be deposition of this cholesterol inside the blood vessels. So once cholesterol starts depositing in the blood vessel, the lumen of the blood vessel will become narrower. The blood flow to the various organs will decrease. Suppose blood flow to the heart decreases, the patient is likely to have heart attack in the future. If the flow to the brain, blood supply to the brain decreases, the risk of stroke will increase. If the blood supply to kidney decreases, the kidney dysfunction can happen. So cholesterol level, this can cause these kind of problems. Increased cholesterol can cause these kind of problems. Similarly, hypertension, increased blood pressure. So that is also one of the major risk factors for cardiovascular diseases. So increased blood pressure. So blood pressure has two parts. One is systolic blood pressure, other is diastolic blood pressure. Systolic blood pressure happens when heart is contracting. Heart is pumping blood outside the heart. So the systolic blood pressure is measured at that time. Now, if suppose this blood pressure increases, heart will have to exert more. So it will have to work more compared to the people having normal blood pressure. So over the time, the chance of developing heart failure will also increase in patients having hypertension, other than causing cardiovascular diseases such as coronary artery disease, stroke, renal dysfunction. Increased blood pressure can cause other problems also along with these things.
Yes, sir.
So it is very important to
so we talked about
and
and take necessary measures. Yes, definitely.
Before developing these
diseases. So to take necessary measures, what are the lifestyle tips and the dietary tips that all of us can follow in everyday life?
Right. So when patient develops these risk factors, or we can prevent from developing these risk factors with the help of lifestyle modifications. Even if the person has developed, this is the first treatment option which is given to the patients. So in lifestyle modifications, there are various parts in the lifestyle modification, various steps. First of all is about the diet. We have to modify the diet. We should increase the intake of fruits and vegetables in our diet, and we should reduce the saturated fats in the diet, trans fats. जो बाहर की ऑयली फूड्स होते हैं, आइटम्स होते हैं, those should be decreased in diet. तली हुई चीजें should be reduced. This is about the diet. We should increase fruits and vegetables, green leafy vegetables. Second thing is about the exercise, physical activity. Physical activity is very, very important. So at least 30 minutes per day of moderate kind of exercise is recommended for all the healthy people, even if they don't have any diseases. Even then, this kind of exercise is recommended. So 30 minutes of walking, jogging, cycling, this is sufficient. So if you are able to do this kind of physical activity on a daily basis and you are maintaining this kind of physical activity, this is very good. So then third thing is reduction of weight in obese patients. If the person is obese, then reduction of weight is very, very important. Obesity is associated with all these risk factors, cardiovascular diseases. So reduction of weight is important. Then fourth thing is smoking cessation. That is most important thing I'll say, because smoking leads to increased inflammation in the body. This causes thrombosis, this can cause heart attack, this can cause other problems in the lungs also, and this is a major risk factor for developing cancers. So smoking doesn't have any beneficial effect in the body. This should be completely stopped if person is smoking. Then fifth is moderation of alcohol. If this person is taking a lot of alcohol, then he should decrease the amount of alcohol. Then management of the stress. If person is having mental stress a lot because of the job or because of his daily lifestyle, then he should try to reduce the stress. Various measures can help in reducing stress, such as yoga, exercise, and if he is not able to manage by himself, then he should take professional help from the doctors if he is not able to manage daily level of stress or anxiety. These things are going to control these risk factors, which can later on lead to cardiovascular diseases. So prevention and control of these risk factors can be done with lifestyle modification. This is our first thing we suggest to the patients or normal persons who don't have any of these diseases.
Lifestyle modification is a must. So so we have to take a good care of our diet. We have to eat more fruits and vegetables. Those people who are smoking or drinking excess alcohol, that should be stopped. And exercise is a must. People should take out time for themselves, at least for 30 minutes in the morning, and then that helps them to, because everyone is living a sedentary lifestyle. We go to office, and then most of us do desk jobs, and lack of posture, and it gives rise to many ailments. So this all things should be followed. Thank you, sir. So we talked about high blood pressure, we talked about high cholesterol levels. So is there any connection between the two? Like if suppose somebody is having high blood pressure, can that give rise to high cholesterol levels and vice versa?
Yeah, these two major risk factors are connected as well as independent. In the persons who have cardiovascular diseases, it has been found that approximately 15 to 30% patients will have coexistence of these risk factors. Hypertension will also be there, high cholesterol level will also be there. So when both of these risk factors are present simultaneously, the effect is additive in the body. So the chance of developing cardiovascular disease is going to increase. The person has higher likelihood of developing coronary artery disease, stroke, or kidney disease. So the risk of these illnesses increases if the person has both risk factors. So it is more important to control these risks if the person has various other risk factors. So we calculate ASCVD risk in a person. If the multiple risk factors are present, the risk score is more. And as the risk score increases, the risk of developing, the chances of developing these various heart diseases and other problems increases over the time. So it has additive effect, and one thing can affect other also, like if patient has hypertension, then the risk of developing high cholesterol level is also higher. If the patient has high cholesterol level, risk of developing hypertension is higher. So if patient has one risk factor, the chances of developing other are higher, and the coexistence of these risk factors will further progress or further worsen the other cardiac diseases. So it is more important to give weightage when person has multiple risk factors.
Yes, sir. Thank you, sir. all those people who are witnessing high cholesterol levels and high blood pressure, what they do is they search for natural remedies. They search for remedies. What can be done? They go to Google and then. Can you please tell, like, are there any remedies to be followed, or is it safe, or if one should just go on proper medication? Can you give us more insights about that?
I'll say whenever a person tries to do the research on internet or on Google, most of the time they'll get the remedies, but they are not helpful. Even some they'll get suggestions on various types of things, including diets, including natural remedies. They are not many a times helpful. The lifestyle changes which I suggested previously, those should be followed by every person if they are at risk of developing these these diseases in future. So these lifestyle modifications are more important compared to like other natural remedies. Most of the time, yeah, they will confuse you. They'll prevent you from getting medical help when you actually require some help. So do these lifestyle modifications, manage your diet, decrease saturated fats or high cholesterol diets, decrease these things, increase fruit intake, increase vegetables in your diet, do physical activity, exercise on regular basis, jogging, cycling, swimming, whatever feasible for a person that can be done. So this exercise, dietary modifications, smoking cessation, these are the more important things, and when these things are not helping, you should seek professional help. Go to your doctor, physician, cardiologist. They will tell you that what is the next step once you are not able to control, you are not able to manage by yourself with these lifestyle modifications. Blood pressure is not decreasing, cholesterol level is not decreasing. Then next step is to take medicines. Regarding medicines, there is a lot of like confusion, dilemma. Patients think that once we start these medicines, so we'll not never be able to stop these medicines. So they don't like to seek medical help in first place. They'll think that once we will start these medicines, we'll have to continue these medicines for lifelong. So they don't seek professional help. Even if they seek professional help, doctor advises them, they'll stop after some time. They'll think that there is no benefit or in other ways. So that is the wrong mentality, I'll say. These the risk factors, they don't affect you immediately. But over the years, after 10 years or 20 years, those diseases will manifest in various forms, either coronary artery disease, heart attacks, or strokes, or dysfunction. Then it will be too late. So it is very important to control the risk factors at the onset itself. So 20 to 40 years is the age when the person starts getting these risk factors, these problems, hypertension, dyslipidemia. And after 40s and 50s, they will manifest in the form of other diseases. So this is the time we should try to control the risk factors. So medicines, they will prevent the development. They will halt the diseases if they have developed. So these are very important medicines. If a doctor is prescribing, you should discuss with him the benefit, the side effects, and then they make a conscious decision. Don't assume anything that you'll have to take these medicines unnecessarily. They are not unnecessary. So discuss with your doctor that what are the benefits and what are the risks associated with it, or the side effects, what can be there. So then make a balanced decision, discuss with your doctor, and then continue the medicines as long as they are required.
So before we conclude this session, can you give us one health tip that should be followed by everyone?
I'll say in young age, when the person is healthy, that is the time between 20 to 40 years of age. That is the time when these risk factors start developing. And after 40 years of age or 50 years of age, the manifestation of these diseases become prominent. So before developing the diseases, between these years, we should take care of our body, our mental health, our cardiac health, everything. So we should first of all exercise on regular basis. That is going to prevent many diseases. That is the most important thing, I'll say. Exercise is most important. Then other things are also important, like dietary restriction, modification, smoking cessation. So these are the most important things, I'll say. these should be followed by everyone, so that the risk of developing these conditions, these risk factors, is decreased, and this will prevent cardiac diseases or various other kind of ailments in the future.
Thank you so much, sir. It was valuable, and we got to know a lot about high blood pressure and how to manage and maintain a good and healthy lifestyle. Thank you for joining us.